did a 30-day temp job back in 79, July of 79, under Dave Bowes in the billing department. And then I became a student worker here in the personnel department in February of 1980 to December of 1980. And then they asked me that I want to be permanent. Decided I wanted to go to nursing school, and I left personnel and started working in the hospital. So I worked in radiology department at night. I worked in clinical labs at night. Then I went to telemetry on the 6th floor. And then I did do my nursing here also on the 8th floor. It was a med-surg floor. When I got on board, it was the LSU Medical Center. So I've seen it grow in research. I've seen it grow in personnel. I've seen it grow in education, because we have more med students. We have fantastic doctors who I think are some of the best in the country. Personnel was my fondest. I think it was my innocence, no expectation, learning the job. I can remember a coworker once, Mr. Bill or William Goff, he asked me to go and pick up him a 45 from Stan's record, which was downtown then, Whitney Houston, first song that she had came out with, and it was The Greatest Love of All. I can remember Linda Bozeman, she used to go exercise on her lunch break all the time, walking around the hall. I can remember Jill Journey and Sandy Filia, their laughs were so infectious. I can remember Gloria. She had this pretty sway when she walked down the hall.
Where have you been hiding out lately, honey? You can't dress trashy till you spend a lot of money. Everybody's talking about the new sound, funny, but it's still rock and roll to me.
In 1980, departments of family medicine around the country had a behavioral scientist. They believed in training physicians in mind and body and their emotions, and the communication, all of that was very important. And that physicians needed information and needed to be knowledgeable about things like addictive disease and depression and communication and things like that. So I was hired to do those kinds of things. Well, I was seeing patients and families and working with students and residents and faculty with patients, and I taught things like addictive disease and family violence. And in fact, I got interested in literacy when I was studying depression in families. And one of the medical students, in those days we used to do research on the backs of medical students. We got them for free in the summertime. They had a longer break, and this medical student was doing research on depression in families and came back and said to me, I don't think these people can understand the depression test. They're just checking off answers. So that's when I realized that maybe I need to look at literacy. And there was nothing in the medical literature at that time. Well, the first thing I did when I stumbled upon it, the only thing in the literature was in labor and the military. They had realized people needed to be literate to get to jobs of today and to be able to be in the military with sophisticated equipment and weaponry. But there's really nothing in the medical literature. And so one of the first things I did was walk around and pick up patient education materials and assess them for reading level. And then I developed a reading test. And when I first went to conferences, I was told this doesn't belong in medicine. This is education and doesn't belong in medicine. And so now it's sort of mainstreamed, and people realize that really it's a part of communication, that physicians have to communicate in a way that people can understand and apply it, act on it.
I was hired as a custodian worker where I worked there for many years. I went from a custodian worker to a stocker. I loved those jobs back then. It was pretty interesting. But afterwards, I got a job working on the Department of Auxiliary Services as an electronic technician. During that time, I did go back to school. Thanks to LSU, I was able to obtain my bachelor's degree in information system security, and I continued to further my education, and I received a master's in business intelligence. The final part of my career, which is where I'm at now, I got the opportunity to actually apply for the Chief Information Officer position here at LSU Health. It's interesting about LSU Health Science Center. We were an internet provider for our employees and our students. I remember we maintained 1,000 users. So we actually charged the faculty and staff $12 a month for internet use, for home use, and we charged the students $5. I remember on Thursdays, my job was to actually terminate Cat5 cables, which is the cable that we use now to supply internet to the different areas here on our campus. And one of the most funny things I can remember, the cable group would pull these cables and they would be dangling out of the wall. And it was just me. My job on Thursdays was to go to these particular rooms and actually terminate these cables. And so I can remember trying to get into one of the professor's room to actually terminate his cable at that particular time, because this is internet coming. It's internet coming. And I can remember this guy saying to me, "Can you come back and do that later?" And thinking about that now, and if you compare then to now, what you find out now is that if we lose internet, we go home. Work stops.